But you see, you just made such an emotional statement, so I don't know how like analytical you really are.
Yeah, maybe
No,
that's
but
Well, welcome to the Bite Angle. I'm Dr. Dustin, and
yeah, I'm
the host.
Dr. Jaclyn, and I think our topic today is Google, like in dentistry. Like, do you like Google things in dentistry?
Well, I think definitely in general, I am probably very guilty of Googling a lot of stuff about myself, whether it's medical or dental. So I guess I could take it from that perspective. I don't know. Do you do the same?
No, I thought when you said you Google yourself, I thought you type your name into Google.
Oh no, I just Google my problems.
No, I don't know. Like, I guess I haven't really like done that. I guess like yeah, not really. I don't know. I think I'm an outlier.
Well, I think my wife always tells me I'm a bit of a hypochondriac. So, do you remember that one time actually recently I had sprained my ankle?
Yes,
I had sprained my ankle. It was really bad. I went out for a run, and then for about 2 weeks, it was like super painful. And then after that, I had numbness in my toes. And I think I was telling you about this, right?
Yeah, that
and I was
alarming.
like, only old diabetics get numbness in their toes. So I went on this whole thing about like neuropathy and paresthesia in the toes. And I'm thinking to myself like, oh man, Googling, am I an uncontrolled diabetic at this point? So yeah, I'm definitely guilty of that. For sure.
But were you alarmed about like what was like the top result that you got?
I think top result was just essentially if there's like any type of residual inflammation, it can lead to like compression on nerves, or I mean certainly like I think if you go down a rabbit hole, you know, and I'm specifically looking for, you know, diabetic and paresthesia, it kind of leads you down a certain path, but I'm very guilty of that.
Yeah, I think because like it depends on how you ask the question. Like if you just Google like why are my toes numb, then like I think like there's so many answers that will come out, right?
It's true.
Yeah. So I think like if you say I'm a however old male, I had a recent like ankle sprain, but your sprain, was it confirmed by a doctor or it was just like
no? See, I think that's the problem is that. I probably don't see my physician as often as I should. And so then Google comes into play, which is never a good thing in general, I would say, but it is what it is, and I'm a bit of a hypochondriac.
Yeah, but I think in this part of the world, it's not actually common to have one family physician. I think in America, is it different?
I mean, I would say, I think it's a fairly common thing what I've been doing. Maybe it's also because I come from the Bay Area. And so like I literally worked like a half an hour from like Google headquarters. And I feel like people are just more inclined to search online or go to social media in order to be able to kind of like research their problem. So it could very well be just kind of the environment that I grew up in.
Dustin is actually from the Bay Area in California. So like, yeah, I guess we should have probably done that in the intro, but I guess from his accent, you can probably tell. I know he always says like people don't understand his accent, but if you're watching this on YouTube, please give a thumbs up if you can understand him. Like he is perfectly understandable, at least to me. So like give him a thumbs up in the comments if you can understand what he's saying.
I appreciate that.
But I mean like I don't know whether it's a Bay Area thing or an American thing, because like I don't know how much like an average GP visit would be in America if you don't have insurance.
I mean, I think most of my cohort peers, they would have insurance, but I think there's still always going to be like some kind of difficulty. Like you had to make a phone call, and then you got to go through a phone tree, and you got to talk to an admin, and then you got to schedule a visit, and then. While I don't think the wait times are as bad in the US, or at least not my personal experience, as they are in Singapore, I do think that, you know, it's still inconvenient to have to schedule an appointment and have to be booked out several weeks in advance. So,
it's that bad?
I mean, it can be. I mean, I guess it depends on like who you're trying to see. If you're trying to see a specialist, if you're trying to see a GP, if you just want to go to, urgent care or primary care. But I don't know. It's so easy just to type on your phone. Just hear what my symptoms are. But with that being said, I think in general, like probably it's not the wisest thing to do. I mean, would you?
I mean, like I can see like for like a small problem where you're like, I don't really need like a doctor, like where you like say you sprain your ankle, like even if you go to the doctor, they'll just give you like some like painkillers and they'll just tell you to ice it, and then you're like, what? Like I didn't need to come here to be told that advice. So I guess like I think for small problems like that, it's like I can see like Google's just more convenient. I think in Singapore for most people, they would be quite happy to drop into like a local GP, and I mean you can usually be seen like on the same day, and I think now most clinics will have like online appointment booking. So I think America is quite different in terms of, or like Western Europe and America, like they're not really into like solutions like online bookings. Like everything is still very like manual, like you have to phone people. And I know people of my generation, I mean we are both millennials, so like talking on the phone is just like, oh no, it's like causes so much anxiety. So I think because in Asia at least, a lot of countries, they've implemented this kind of like contactless appointment booking. So I think it's a lot easier for people to just like, oh okay, I can just book online. And I think there's even like online queue system, so you don't even have to sit there and wait. You can just be somewhere else, and then when it's your turn, they'll like beep you. I
mean, I think it is trending that way in the US as well. But I mean,
I think it's just interesting for like a advanced economy. Like they're still quite old school in some things. Like you would think it's like super advanced. It is advanced in some things, but like very like behind in other things. Yeah, which is interesting.
Yeah, I think that's fair in some sense.
Yeah.
But I mean, like even for you, right? Like I think the other day you were telling me that you were kind of like this a big skincare nerd. Yes. So like even for stuff like, so obviously dentistry is something that you had learned when you were in school. You would consider yourself to be an expert in dentistry. But like for stuff that like, you had to start off as a novice and there was no formal training in it, didn't you resource Google in order to be able to like get a lot of your knowledge?
Yeah, but like the problem with Google, okay, so Google, when it first started, it would just show, I don't know what system they use to organize the results, like who comes out first. So I think it was probably number of hits, if I remember correctly. But then now there's things like SEO and SEM, which like will distort the results based on like who pays the most, like will appear like at the top, at least for SEM. So like now when you Google something, like if there's ads, I'll just like completely ignore the results that are ads, and then I'll go down to the so-called organic, top results. But even now, I think like SEO actually distorts like the results. I mean, not just for dental stuff, but for anything, because people are like doing like keyword like maxing. I don't know what the official term is.
I think you're right. So I mean, like at least from what I remember when I had my practice is in terms of marketing, you'd have like the pay-per-click, which is clearly ads, right? I mean, like you're paying obviously to be put at the very top. It says ad on it.
Yeah,
people click on it. You pay for it. People go to your website.
Yeah.
Then there's like the SEO, but you can game the system for SEO. Right. You can put in certain keywords, just like you were saying. Basically, make it artificially pop. Maybe like. Even if it didn't have all the information,
it makes the Google like spider think this is relevant, because again, like I guess maybe back in the day, like Google had like human engineers like looking at it, but now like because that's too resource intensive and there's just too much content, so they need to farm it out to like a computer, but then the computer can't read it and decide like, is this actually good quality? They just see number of keyword hits that it gets, and then it's like, oh okay, you have a lot of keywords and I'm just gonna put you like at the top. But when you click in, like sometimes like I think now especially clinics have blogs, which is very unusual, like because we knew blogging is like personal diary, so why does a clinic need to have a blog? But then like some of the blog posts is just like word salad. It's just, you can see it's like I'm trying to SEO the heck out of this thing.
That is fair. Yeah.
Yeah. So like if you're patient, then, and if you're not aware of this like phenomenon of SEO marketing, then you might click into the blog thinking, okay, I'm gonna learn something, but actually you're just like seeing like SEO sometimes.
But going back to the basis of the question though, I think like, what made you want to research, for example, health and skincare via internet versus going to a dermatologist directly? You know what I'm saying? Like there's a certain ease and lack of a barrier, right? And sometimes you just want the simple answer. And quite honestly, like I get it. I think, you know, if you're talking about barriers to getting answers, like certainly going to some Google or even some other more reputable website, like in the US, you have like Cleveland Clinic or,
Clinic,
you know, these like more reputable sites that have like good information. Like it's just easier to go to these websites than to make an appointment and see somebody in person. I would suspect for most people at least.
Okay, so my answer to that is weird because like of two things. Like one, I was an encyclopedia kid. So when I was growing up, like my parents bought the entire like encyclopedia. It wasn't Britannica. Like Britannica is not nice because the photos are in black and white. So they got me another one that has like color photos. So like that's like, so I read all the encyclopedia volumes because I wanted to see like, you know, what's inside, and there's no like indexing or anything. So I just went alphabetically, and then I would I just did it alphabetically. So starting from A, and then like the articles that I found interesting, I would like dog ear the pages. So it's like my version of bookmarking. Yeah. So like that's very unusual. Like most people don't do that. And then when I was in dental school, that's when I started getting into like, well, I guess skincare in a way, but I was like, okay, we are learning evidence-based medicine. So I was like, there must be evidence-based medicine for like dermatology as well. And then like at least in this part of the world, it's not common to have like a dermatologist. I think in America or even Australia, like people would see a dermatologist for like mole check and stuff, but like we just like, what is that? It doesn't have any relevance for us. So, and it was kind of seen like as a luxury almost. But at that time, like I was thinking, okay, I need to look for like ingredients or interventions which have like evidence based. So I'll be looking for stuff which has like journal articles. But then like now I know that okay, not all published research is the same. Like there's good research and there's just some really crap studies that don't really show anything, or they have been commissioned like by, you know, the company to prove like something which, you know, is not really like evidence based. So like now I've come back to like, okay, I need to see like an actual professional, so like a dermatologist, because like I mean I was seeing like non-specialists for like some other skin issues, but it was never really like managed to like what I would call like my complete satisfaction. It was better, but like it was kind of like then when I saw like a real professional and like I know she's like really evidence-based, that's why I chose to see her. And I was like, okay, now this is like worth like every penny that I spend. And like no amount of Googling can replace like that kind of expertise. Like because she works like so much. I don't know how she does it. She works like weekends and, you know, whatever. So she's just got like so much like clinical experience. So when she looked at me, she was like, yep, okay, this is your problem, blah, blah, blah. And then this is the treatment. And she was like really confident. She's like, yeah, I'm sure like within like 4 to 6 months, you're going to be like really happy. And like what she said is actually true. So I guess like Googling can help, I mean, to a certain point. But I think where we are right now, I mean, most people might think, oh, okay, I can just do your job because I know how to Google. But again, like with the volume of content that is coming out, like Google can't really organize it in terms of quality for you. It just organizes it based on like some other metrics, like which may not really serve like the public good, I guess. Yeah,
absolutely. I mean, I think definitely, so I think there's a couple takes on it, right? So one is to say like, you know, you can be kind of the old school and be like, okay, well, there's the internet and I'm going to reject the internet and I'm going to stick to traditional means of seeing a physician, seeing a dentist, whatever it is. But then there's also like, I mean, I've got 2 kids right now. And I think in raising the 2 kids, there's a certain amount of this is the way of the world now. this information is always going to be accessible, whether it's good information or bad information. And right now it's a matter of being able to teach my kids how to sort through it, right? Because it's not going to change. Like, it's not going to all of a sudden like revert back to when it was like, pre-internet, like in the 1970s, where everybody had to look up things in encyclopedias, right?
Yeah.
So I think, if we accept the context that this is how the world is right now, I think we just have to learn that, whether it's going to a physician or going to a dentist, there's going to be stuff that's online, which is absolutely not going to be accurate. And you just have to be hopefully wise enough to be able to distinguish or maybe realize that a lot of these things are not going to be answering your question to the extent that you want it to. And you really need to depend on, say, a working professional like a physician, a dermatologist, or a dentist to be able to like be a soundboard for you or to verify things for you. Like, I don't think there's a substitute for that at this point in time.
Yeah, and I think what you're talking about is like media literacy, which is not taught in school. Because, anyway, that's a conversation for another kind of podcast. But yeah, I think especially now, like with social media is another catalog of like information. So, I mean, I found my dermatologist through social media. So it can be a good way to like discover like different viewpoints, like different people. But it's just like you have to really critically examine like what they are presenting, because it's a lot nicer to consume like a short video about something. But again, the problem with like short videos is that they can't capture nuance that well. That's why I like long form content. So on like YouTube, like our podcast, which is long form, because I feel like or maybe it's just like a generational thing. I think like as you get older, you have like the need for like deeper like kind of discussions. Like superficial stuff, it's fine, but sometimes I may discover something through like short form content and then be like, oh, okay, this is interesting. Then I'll go off and like look for either long form content or like research more, because I want to hear like all the nuance that comes like together with it. And also I think for social media, like I'm always like quite skeptical. I always just take the view that someone's trying to sell you something. You just don't know what they're trying to sell you. So like I would say, like things that influencers say, like I just take it with a giant block of salt. It's like somebody's making money somewhere. Like, of course, like as professionals, like of course we can have social media as well. Like in Singapore, at least, like we are quite heavily restricted. So, I guess like we don't have that kind of ecosystem like in America, where like even I think professionals they can become like almost like influencers in their own right. But I think the FTC is like quite strict on for people who don't know, FTC is the Federal Trade Commission. So I think they are trying to like regulate the influencer industry. And I guess like as a professional, if you do take like sponsorships, like you have to declare it so that people know like you have a financial interest. But I think in this part of the world there isn't really that kind of regulation, and definitely not for professionals. Like, the long way around to the answer is like, yes, like we need like media literacy in general, but it's quite difficult, I guess. Like, and even if you're not being sold a product, like sometimes you're being sold a point of view. So people have an agenda, like always, and it's just like figuring out like, okay, what's that agenda? Because like, maybe we grew up in the era where like the internet was quite pure in a way. Okay, it's not pure because there's 4chan, but pure in like there wasn't that kind of monetary like compensation. Like people like would make websites, just because they want to like make a website about a particular topic, but there wasn't any like monetization like behind it. So like now the current internet is like very different. Like everything is about like how can we like monetize this.
Yeah, I think you have every right to be skeptical of what you see and consume online, for sure. Actually, I had a question. Like, if I want to circle back to dental, like I had a lot of patients, for example, when I was practicing in the States, and I don't know if it's as common here in Singapore. I haven't encountered anybody who asked me the question, but they would ask me stuff like about, for example, oil pooling. Okay, like so this is stuff I don't know. I speak for myself. I'm not speaking for Dr. Jaclyn, but when someone asks me about oil pulling, like I remember the first time I'd ever heard about it as a dentist was when a patient asked me about it, and all I could really tell her was I have no idea what that's about. I mean, I can look it up, but when I look it up, there's like a dearth of information. I was actually looking it up recently, and I think they had one randomized controlled trial back in 2022. But I remember when somebody first asked me about oil pulling was probably, I don't know, 2015.
Yeah, I heard about it at that time as well. Yeah. I think it was a trend.
It was like I don't know if it's like an insecurity or what, but as a dentist, like I feel like I want to be able to provide them a really good evidence-based answer to this. But I think for a lot of these trends, they just don't have evidence-based yet.
like no one's gonna fund but I guess like somebody did fund a study about oil pulling, but it was like how many years too late, right? Like almost a decade like after the thing. But yeah, I mean, I had patient ask me about oil pulling. I did hear about it. I can't remember like how I heard about it. I think it was like through a blog or something. Before like YouTube was like a big thing, but I think it actually comes from like an Ayurvedic practice.
Yes.
Yeah. So it's like an actual thing, but like white people have co-opted it. So like I remember at one point, it was like super popular, and like there were a lot of claims like it can eliminate bad breath. And I remember the one that was everyone's interested in was like whitening of teeth.
Yes.
Yeah. So but when I Googled it, I remember
you did Google it.
Yeah, I did, because I was like, no, I can't remember which came first because it was so long ago. But I knew about it when the patient like asked me. But it sounds like very unpleasant because it's not just like gargling for a short time. It's like you have to keep the oil in your mouth for almost like 20 minutes. Then I was like, oh my God, like who has time for that? So like, yeah, and at that time there was no like evidence, but I think I see it also in like dermatology. I mean, I'm not a dermatologist, but I just have it's like my hobby. A lot of things that consumers are interested in knowing the answers to, there's no like evidence for that because people are not studying that. Like they're studying like other stuff. Like, for example, for us, it'll be maybe like, it's either like basic science research, which is very, very abstract, and then they're going to change it into like applications in the future, or like evidence-based practice, which is more relevant to like what we want, but like that doesn't answer the question like that consumers have. So consumers and patients have like, I mean, yeah, some of it, their interest is aligned with like evidence-based practice, but sometimes they want to know like, oh, is more fluoride like better, like, is more better, that kind of thing. So I think that kind of research question may not necessarily get the funding.
Yeah. I mean, at the end of the day, like, probably research really, really sound research may never exist on this topic. It could very well be, right? But I think I do think that it's good for maybe patients to realize they can ask us about it, and I think it's good that we have all this experience and we can speak to kind of like just general sound principles. We may not have evidence to be able to back it up for some of these things, but I think, we've been around the block enough times that we could say, hey, this may sound like a good idea or not sound like a good idea. And I think that's what's also really important, that's something you may not get from Google, right? I mean, it's like the sounding board of a person who has the experience, that even if there's no research behind something to say like, hey, I haven't read any research articles about this, but this sounds a little wonky, or this sounds good, or this sounds a little harmful, or this doesn't sound harmful, you can go ahead and do it. I mean, it's the same thing with, I think when vaping first came out, right? Vaping is like a huge thing right now, and there is a lot of money being put into it. Yeah. But when it first came out, people were asking about it all the time. They were like, can I do this instead of smoking, for example? And so I think, there wasn't research at the time for us to be able to advise. I guess in Singapore, they put a clamp down on that pretty quick.
No, but like, I mean, Singapore, I think, okay, I'm not Singaporean, so don't come for me. But I think Singapore is generally quite conservative when it comes to guidelines. So I think a lot of the guidelines that we have are actually based on American guidelines, because a lot of our public service scholars and civil servants actually do go to America. So we actually have quite a lot of like academic and links with America. So for example, our guidelines on antibiotic prophylaxis is based like on the American Heart Association one, which is like quite different from the British one. So I think like Singapore tends to adopt a like, wait and see, like, okay, what does like America or like the EU say about this? And then they kind of like, okay, we'll just follow like the general consensus. But I think also like, as far as like vaping goes, I think once the evidence came out that it was like harmful, like I think it's even worse than cigarettes, like in some cases, like then they were like really clear, okay, we have to like totally like clamp down on it. It's just very difficult because like the neighboring countries like Indonesia and Malaysia, like they haven't outlawed vaping. So just geographically, yeah, it's always going to be like some cross-border things.
But I think it was just like an interesting, like I laud patients for trying to think of a healthy alternative for them to be able to go like outside of traditional tobacco use. And I think that's great. And I think that they should do stuff like Googling, that type of thing. I think it's just in the clinical setting, when a patient sits down in your chair and is like asking you about this new thing, which either you haven't heard of or you're like, certainly it's so new that there aren't any like, scientific evidence.
How comfortable are you like giving your professional opinion if there is no scientific evidence?
I think I would just preface it. I would just say like, hey, I haven't read any scientific papers about this particular thing, but principally like, I can probably say, the word's still out. You should probably avoid it at this time. Like, I think...
but it sounds like you're more like, you still want your evidence base to be there.
I do. I do. I mean, I think everybody... I think that's what we can
like
fall
in
on.
dentistry, right? Like we don't have... even for our like... Remember like a few years ago, there was that thing about like flossing is not evidence-based. Do you remember that? Yeah, but like... obviously we're not going to tell patients, just because there's no evidence, you don't have to. So I feel like we in dentistry, like we suffer a bit because there isn't as much like really good clinical, like evidence-based research for us. Like even for simple things like flossing or, other things. Like, so actually a lot of the stuff we do is not 100% evidence-based.
True.
So I guess like I'm different from you in that, because I know that. So like I'm not gonna like refrain from giving my opinion just because something doesn't have an evidence base. And just knowing how like research is run, like we can't research like every single thing. Of course, if we had infinite resources we could, but like I guess like just like the oil pulling thing, I think my patient asked me, I said, okay, like I don't think it's harmful, it's just like it takes a lot of time, so I don't want you to neglect the stuff that we know works, so like flossing and brushing and all that. But if you wanted to add this on, then I don't think it's going to hurt.
Yeah, I think that's where, the value of a dentist and a physician will come into play, right? Like I said, even if there isn't evidence-based, oftentimes we'll still give our opinion and be like, hey, you should be cautious towards this. Or, hey, it doesn't seem harmful for you. Maybe you can go ahead and proceed. Like they describe to you what oil pulling is and you're like, it doesn't seem that bad. Like if you really want to, go ahead.
But I think the one that like really gets my goat, where I really detest Google is the fear around fluoride. Yes, that is where Google is like, Google, you're not helping us, bro. Yeah, because like you have those patients who read that fluoride is like toxic. It is, but
the concentration that they're
you're gonna take the fluoride powder and swallow it, of course. Like it's toxic.
That's playing out in the US right now too with RFK Jr. They are
it's just a continuation of like whatever has been happening. But I think the fluoride thing, as far as like 10 years ago, there were like there are patients who come up to me and say, I don't want to use like fluoride, and we try, but I guess that's where like, if you are their dentist and you they have a really low risk of decay and they tell you, I've been avoiding fluoride for all this time, then I'm like, okay, cool. Like for right now, it probably is doing okay for you. But if things change in the future and the balance changes, then maybe like it may not be good for you like in the long term. Yeah. And also like I don't know if Google actually flags things for misinformation, because like I said again, it tends to put like search results at the top that are like really popular. So sometimes like you can make like a very misleading piece of content or like rage bait, and then people will click it and then they put it at the top, but not because it's actually giving you good info. It's just because, oh, everyone's like interested in it. So
yeah, I mean, I think right now we also have to distinguish between, I mean, something that's fairly new would be like the AI summary at the beginning of a Google search query, right?
Yeah.
And so I think right now Google seems to be crawling through the information that's available and trying to be able to give out a best practice simplified statement. But I think there is a danger in that, right? I mean, like, it's not like you're telling Google, here's my medical history, here's like my dental history, I had a filling here, and I traditionally have a super high cavity risk, what could this little black dot on my tooth be, right? Like there's a certain amount of, you can't give Google enough information that it's going to be able to give you a necessarily accurate response. I think that's where, ultimately going to a clinician who has had years of experience is able to kind of summarize and distill all that information and be able to give you a good recommendation. But I think therein lies the danger. At least the current state of where Google and AI, for example, are now, I just don't think that you can depend on it for your medical needs.
Yeah, I mean, the AI feature is quite useful because, I mean, traditionally, people wouldn't click past the first page of results, right? So I guess like you hope that the summary is summarizing the don't know how many million results that are available when you do a search. So the other thing about, I mean, AI is only as good as the data set that it's trained on. So I mean, Google is primarily like English language results. So unless like, I mean, I don't think it's possible to like ask it to summarize like, from different like language sources. So even for like research, like if I use Google Scholar to search for something, like, I mean, we know that it's not going to turn up research in like, Chinese language. China actually produces a lot of research, but it's just not accessible to us because there's just that language barrier there. Or like, even other countries, although most researchers try to like publish in English, but again, it's like, I think that view may change, or maybe like AI like DeepSeek, which is based in China, can like change that. So it'd be quite interesting to see like compare different AI models. So like if you ask like ChatGPT, Google, and DeepSeek like the same question, like what results are they going to give you? It'd be quite interesting to see. I haven't tried it, but and also I think as far as seeing a professional goes, I'm actually quite comfortable telling my patients sometimes like I don't know. Or like that question about the black dot, and I mean, we have your history and everything, but for a new patient like in front of me, like I don't really have experience, monitoring them over time. So sometimes like unless that we are so sure about something like 110%, then I might just say, let's just monitor it. Like if it gets worse, like we can fix it then.
But isn't there like no substitute for what you see clinically? I mean, like you have all these like text-based AI solutions, right? But it's like at the end of the day, like there is something to be had. There's tons and tons of value of being able to actually see the patient clinically. Like we're just not at the point of technology where we can do it without that type of like clinical evaluation. And I think maybe, I don't know.
I think image-based, like if you can, actually what you could do, I don't know how feasible this is like if you photograph like every single patient and you have a catalog of images, you could actually train an AI model on your data set, which is like the pictures. And I know people are developing program AI now to like interpret x-rays, which is the same thing. Yeah. So I think eventually that may be possible, but like I think what you're saying about in-person or like having another professional evaluate is like in the end we are human, so like we are prone to bias, and I think like as much as we like to imagine that we are like rational human beings, like I think things that will tend to affect like our professional opinion is of course like you know how tired you are. Like if you're just done with a really difficult case, and then it's like almost end of the day.
Sure.
Yeah, then you're just like, oh, let's just get it over with, and then you kind of just make decisions on the fly. Although sometimes I feel that those decisions are, because they're almost like instinctive, like it tends to be like pretty spot on, rather than you like overthinking like through.
I mean, that intuition also is a factor of your experience, which is in its effect a data set. It is your data set that you had received over your 20 years. Like you practicing it, like if you practice in a rural area, may be very different from your data set if you practice in an urban area your entire life. So, but I do agree. I mean, like I think AI eventually will help to, I think one of the beauties of AI is you could standardize treatment a little bit more, right?
Yeah.
I just don't think it's there yet. But I do think it begs the question whether you think it will ever get to the point where we actually will not need a clinician. Like, for example, right now, I guess if I'm talking specifically about dentistry, you touched on x-rays. AI can definitely interpret x-rays. That tool is being used even in practices in Singapore. I've seen it being used here.
My friend actually started a company that does that.
Yeah. There you go.
Yeah.
There's also robots now that can do preps, right? They can do crown preps. They have robot-assisted implant surgeries. They have all these things that I would say, traditionally are in the realm of, oh, I'm a clinician, robot can't replace me. But it does seem like technology is starting to get to the point where it's starting to, maybe erode away a little bit at that, about that adage. But I think I don't know. Do you think it'll ever get to the point where we could have a technician or a computer basically take you from start to finish, go from presentation or clinical exam to diagnosis to treatment plan to treatment?
I think, so I worked in another practice where they actually experimented with like a AI-driven diagnosis and treatment planning model. So basically they had the patient take like a set of standardized pictures, and then the AI would actually diagnose, although it's a bit clunky, but you can see like some pretty obvious things, and then it would make like a treatment plan. But so I think that part is possible. You can actually train like an AI model to do that. And I guess like removing like the emotions, because like I said, your decision making is affected like by other factors. So I mean, as a patient, it might be a bit disconcerting to hear that, but it's just true. And the other thing that I think we are affected by, although we don't realize it, is a recency bias. So like if last week you saw like a bunch of patients that presented in the same way, and you like did all your treatment plans in the same way, the next patient you see like most likely is going to end up like that. And conversely, if like you had a bad experience with this treatment last week, you're like, oh, okay, I don't want to do it. So I guess like AI can like smooth out that kind of inconsistency, and maybe for like a younger dentist who's less experienced, like it can help to, it's like the training wheels, just to help them make sure that they are not missing things out and or treatment planning correctly. But where the treatment comes in, or like even coming back to the treatment plan, like treatment plan is one thing, but I feel like in the end, patients make decisions based not on data, they make it based on emotion. So if you take out all the emotion from that process, like, sometimes like I feel it may not, I guess like it removes the pressure from the dentist to like sell the treatment plan, maybe.
Yeah.
Some people might feel comfortable with that, but like elective treatment, especially like aesthetic dentistry or cosmetic dentistry, like, do you really want a computer to like tell you what you should look like? Again, it's another like philosophical question. I feel like, beauty is in the eye of the beholder, and even between like different cultures, like they value like different things. So coming back to American people again, like, they want that super wide, like they can't even tolerate like a little bit of discrepancy. That's like a really big no-no for American patients. But for like European or Asian patients, they are actually more tolerant of like some small discrepancies that just make like the smile look a bit more unique. Like they don't want to be all like put into the same box, which I think AI may have a tendency to do that. So I guess like AI can help to standardize the diagnosis, but in the end, you still need like, as in, the clinician still needs to know the person, like as a person, like, okay, how do you think this is like the right thing for you?
So do you think, like, I think AI is going to eventually be able to provide us treatment plans, like you were saying. It's going to analyze data. Let's talk about further in the future. Analyze data, give a treatment plan. I do wonder, like, they have that old adage, maybe it's because I was an engineer in a previous life, but like engineers are super analytical, right? And I feel like AI would be ripe for an analytical individual. Be like, here's option A, B, C, D, here's pros, cons, everything like that. But then for those people who are not as analytical, who, like you were mentioning, like maybe more emotional, maybe they don't want all the data, they don't want to be so confused about it. They want, like, doc, should I do this root canal now, or should I get this tooth extracted? Like, I want to have that. I wonder if technology will eventually get to the point where it can say, like, I like to be able to, like, give that individual an answer that they want, rather than just being able to give all information. Like, I wonder if it'll eventually get to the point it can, like, kind of push the emotional aspect to it and see if, and touch the buttons based on the recipient, on the patient, and what they want.
I think it may be possible because, like, you heard like people asking like ChatGPT, as in they're treating ChatGPT like a friend or a therapist. So they keep typing
like that movie,
different prompts.
Her or whatever it is.
Yeah. I mean, they type different prompts to see like what
right.
it will come out. So I guess maybe something like that. Or another model could be like, you still have a clinician doing, like, making the final decision, because, like, again, with AI, like, if it's totally done by AI, then who's liable?
Yes.
Like, yeah.
I think that's a huge problem. Even if a person who, like, coded everything, it's like there's so many data points that they can't even tell. I imagine at a certain point in time, like, machine learning cannot tell how it came to this decision, because it already processed so much data points beyond the comprehension of any individual, even if they're an expert in that field. Basically, at some point, you are leaving the computer to do its computer thing, right?
Yeah.
But who's liable if something goes wrong? If AI ends up making, like, if we're it's 99% correct, but that 1% that's incorrect, who's liable for that 1%?
Yeah, and is the patient going to be able to sue the clinic or the AI provider? Like, I'm sure they're probably going to write it into their clause. Like, when you sign the contract, it's like, okay, we're not liable. So that you can't fully, like, automate the process, because then, like, I guess it's bad for us. Like, okay, if patient wants to sue you, but at least there's, like, someone there to, like, take ownership and say, okay, we'll fix it. Like, I mean, things don't always go to plan, but at least like, okay, you have some redress. Like, things are not just going to be left like that.
But I think healthcare is special, though, right? I mean, like, for stuff like, what's the best, like, can of pasta? Like, I don't mind AI giving me a recommendation for the best can of pasta, but, like, when it does come to your health, there is, like, a certain... It's like it is a certain territory that has to be, like, sacred and treated a little bit differently. But
you just made such an emotional statement, so I don't know how, like, analytical you really are.
But
I think, okay,
I'm no longer an engineer, so there you go.
Okay. No, but, like, I think people, no matter whether you're analytical or not, like, you still make decisions based on emotion, but you use the data to justify, like, okay, I did this because whatever else. So I think the AI can help us, like, as dentists, to kind of say, okay, like, we still need to get down to, like, what the patient wants, which is the emotional thing. But, like, we can say, okay, this is what the AI is telling you, why it would be good for you to do this kind of thing. So it would be good for us, like, if we can use AI to, like, help us, but, like, we have to, still remember that we are in the driver's seat, and the patient is in the driver's seat, because we are there to, like, advocate, like, for the patient, because it's, like, really confusing. Like, they only have experience with their case, like, while we have seen, like, other cases and things like that. And AI, I think it's good for, like, dealing with large, like, amounts of data, but in medicine also they're moving towards, like, personalized medicine. So it's like, okay, are you really going to distill your patient down into just, like, one data point, or are you going to, like, personalize everything? So I think the last industries which will, still stand, even though, like, AI is taking over other things, is, like, stuff which is, like, super personal. You can't, like, replace that with AI, or like jobs which require like a physical presence. So for example, if like you wanted to get something tailored, like there's no way AI can do it for you. Maybe in the future, I don't know, they can measure you or something, but like for example, if you're like, oh, okay, I want to shorten the sleeve, but like, does it look good? Then like, can the AI actually give you that answer? Or like, you know, healthcare, like, yes, AI can do like some things pretty well. Like I think they were saying like pathology reports, like, yeah, AI can probably do that, but like you still need like nurses, porters, because the patient is still like a physical thing. Like you can't replace
I think you said
it.
something like that's pretty subtle, but I think it's really important, and that like as a clinician, you always like your priority is to the patient. That's what your responsibility is to at the end of the day. But if you are Googling your health information, is Google really like, are they prioritizing like the well-being of the patient, or are they prioritizing traffic, or are they prioritizing places that are gaming the SEO system? Like it does, I think that like at the end of the day, that could be like the soft but important vital difference between Googling stuff or seeing seeing a dentist or a physician. Like, maybe AI can process more information than I can, but at the end of the day, I think you're right. Like there's a certain amount of who's going to advocate for you, who's also going to take responsibility or liability as well. And so I think that is actually a really important but salient point, like a very, very important point about that.
Yeah, and I think because like how the students like in the professions learn is, I think it's changing. Like, all the profs say like people are like using ChatGPT to write their essays, and if you want to do like your research now, like you can just get like AI to troll it like for you. But I think then the emphasis in like those like professional schools would be on like ethics, and like again it comes down to the bits of us which AI cannot like replicate lah. Yeah, so I mean now like they screen like potential dental students for like academic prowess and stuff. I mean, yeah, it's important, but like it's the other part which you can't measure, like you say, like your integrity and like how committed are you to like do the right thing. Because like when you're in school, yeah, I mean your prof is like watching over you, so you can't like really mess up. But then like what do you do when like there's no one there to check like that you're doing it correctly? So I think those things will become like more important, and I think that's what patients actually are looking for. Because like if everything is so efficient, like why do people still like, I mean, it's like okay, if you're going from like one city to another and there's like an option to take like super fast train, some people would take the fast train because they need to prioritize like saving time. Then some other people are like, no, let's take the scenic route. Like why do we like do these things? So I think it's still, I'm quite confident that we're not going to be replaced by like AI or Google or whatever, but maybe some of the more like menial tasks or stuff where like it's hard to find like manpower to do it. Yeah, it makes sense. Like that's what AI is for.
Well, I think like one of the big things about technology is, I mean, you were mentioning like standardization of care, right? Like, but then also like there's a certain strata of care too, in some sense, because there are definitely populations that are underserved. I mean, I don't know about for Singapore. It is such a small country, but I'm sure even within the small country of Singapore, there is lots of populations that are underserved. But like where AI can probably do a lot of good is probably going to these places and giving them a certain standard of care that they can't get because they can't afford to see someone in person. So I think that would be a huge opening, or just a huge benefit of where that's going to be. And yeah, I am quite excited about that, but it does make it like beg the question, like, well, how well is AI actually going to be able to do these things? Like, and is it right to have a strata of care? It's probably not right to have a strata of care either from an ethical standpoint.
Yeah, but we live in a capitalist society, so it's just capitalism. So yeah, like I mean, if I think if we live in a capitalist society, like for everything, there's always like levels. You can't avoid it. So I mean, even in Singapore, like if you are on a budget, then you eat at the hawker center. If you like, I feel like treating myself, then you go to like Michelin star restaurant, and they are like just two totally different ends of the spectrum. And like what you were saying about underserved like communities would be in Singapore, I guess, like migrant workers, like domestic and like construction workers, or like people who work in shipyards and stuff like that. So they may not get like the kind of access that they want. But
would you almost consider Google to be a strata of care? It's instantaneously available. It is free.
But I don't consider
can answer general
care.
questions. I mean, like, yeah, I mean, like, it can answer like general questions. I mean, in one sense, we're thinking like, oh, way off in the future when AI becomes really, really developed. But like, if you look at it now, maybe
But
like Google is just the poor man's physician and dentist.
Yeah, but like I don't consider Google care. I just consider Google like encyclopedia. Like it will tell you stuff, but like, okay, now you know the stuff. Like, are you gonna Google how to do it yourself or something?
I mean, there are certain times when you don't need pharmacological remedies or surgical interventions, when it would just be good home care. I mean, for example, like patients may come to us and they say like, oh, I've got irritated gums for the past 2 weeks. And I look at it, it's like, I don't really see anything. I think you just need to brush and floss better. You know, they probably could have gotten that off of Google as well, right?
Yeah, I mean, to be fair, I think like our patients are not dumb. So they probably tried that, but like, yeah, I mean like brushing technique is very difficult to explain like in words. So I usually have to show them like, you know, in person, and like, you know, there's certain things which like I guess there's still a lot of myths like around. For example, like oral hygiene. But yeah, I think, yeah, because that question to me is not valid because I don't consider Google like care. Unless like you can Google and then you order like your solution like from Google. Maybe.
Yeah, I mean, like, suppose you could. I mean, if you take it one step further, I don't know why I'm even, but like, if you take it one step further, you have like Google to screen it. Then you're like, oh, I want a solution, so I'm gonna ask ChatGPT because I got like, you know, I'm paying a monthly subscription for ChatGPT and I get 20 questions or whatever it is that I get. So you're like, oh, I'm gonna pay some money for ChatGPT to give me the diagnosis and the treatment, like. I
think you just need like a flying doctor to come in and do the last bit, like in your house. That would be the only way to like close that loop. I think, yeah, it's just, I don't know, maybe I don't have enough imagination about like where it's gonna go.
But I think dentistry is also a little bit different than like
GP practice.
Yeah, GP practice. I think dentistry is for better or worse, it is very surgically based or like procedurally based, right? So, you know, I think first will come, you know, diagnosis, but then probably later that diagnosis will translate to like more sophisticated treatments, maybe that don't require a clinician to go to 4 years of dental school in order to be able to do. But like as of right now, like so much of what we do is like
it's
very,
like
very technical
surgery every day. I mean, like everything is like surgical in a way. Like filling is just a little operation on the tooth.
That's true.
Yeah, I mean, each of the teeth is an organ, right? So technically, you have like 32 organs that you need to take care of. So I think, but what you said about the robotics assisted like procedure, I think that would be really exciting. I mean, physicians use it nowadays, like for their robotic like microsurgeries and things like that. So I don't see why like we couldn't use it. Although I want to see how the robot's gonna manage like the patient's tongue, because like usually I think for robotic, I think I've seen for endoscopy where like I mean the patient's not moving and like
Well, I think that actually they could have like a little chamber that just sits over the tooth, and you have like essentially a drill within this small chamber. But it does require a person probably. I mean, usually those robotics one that I mean for medicine I've seen is like there's a surgeon actually controlling the robot. Yes, I think so. When I did my residency, that was like the coolest thing is seeing this Da Vinci surgical device. Like, I was just so floored at what they're able to do, and like quite honestly, I was like, these guys are playing like these surgeons are basically playing video games. Like it just looks. And I feel like at some point in time, the price point will be such that you know it'll probably trickle down to private practice and dental offices eventually. Like you know, like right now it's $1 million for a Da Vinci machine, or probably much more than that. But at a certain point in time, it's going to come down. Like I think if you look at these CAD CAM machines, or you look at these devices that we use on a regular basis, they used to be exorbitantly expensive, and now as prices start to go down, it trickles more and more down to smaller private practice offices. So I think definitely may not be during our lifetime. In fact, I hope it doesn't come during our lifetime and put us out of a job.
I want a robotic assistant. Then I'll get nice preps every time. No, but I think also the thing about medicine and dentistry is that for medicine, a lot of those innovations, they are meant to be used in big hospitals. So they have the patient load. The patient load is there. That's why the hospital will buy the thing. But for dental, because in most parts of the world, we don't really have big dental hospitals, except maybe in China and the Baltic countries. So most dental practices are small mom and pop shops. So it's you're not really gonna have the resources to get that kind of kit in. And even if you did, you're okay, are your patients actually willing to pay
but eventually the price point will come down. It's just
but I don't think it's going to come down.
It could be a very, very long time before who would have thought 50 years ago that we're scanning, milling a crown all within the same day and being able to deliver it? I don't think they would have known that 50 years ago. And who knows what the next 50 years is going to be like. So I wouldn't put it out of the realm of possibility. It may even affect us in our twilight years. Yeah. I think that, for example, in dental school, I used to have to cast gold. That was a thing for us. And it's something that I don't know who's listening, if it's dentists or patients, but casting gold is medieval technology. It's really,
it's not even medieval. I think it's ancient.
Yeah, it's really crazy, right? But then and then I hear new students that are coming out of school, they're not casting gold, and they're doing most of the stuff with CAD CAM technology now. So I wouldn't be surprised if during our twilight years of when we're ending our career, that the new up and coming kids probably know how to use robots and are more into programming how the robot is going to do the surgery rather than actually doing the surgery with their hands. I wouldn't be surprised.
Yeah, but I'm sad.
I hope not.
No, I feel to summarize that point, it's more if you are a good surgeon and I give you a tool to help you, you become even better. But if you're a crap surgeon, and I give you this tool, you're still gonna do pretty crappy surgeries. So, and even the point about gold, the way the geometry of the preps for gold is very, very specific. So I've seen dentists who are very familiar with onlay or very adhesive kind of preps, they struggle a bit with having that very exact kind of geometry. And I think everything that is old becomes new again. Eventually,
But I can imagine on a screen, you just see it, you scan the initial prep and be I want a gold crown. And it's like a latte machine. You're I want a cappuccino here. I'm going to press this button. Or I want a ceramic onlay. I'm going to press this button. I feel it's going to be something like that. So you were mentioning there's so much variability in skill, for example, of whether a person can adapt from gold to porcelain and vice versa. But I feel if you really did have a machine that's able to do this for you, it's just a press of a button. I could have the ideal gold prep, right?
Yeah.
So I think, I don't know, technology is exciting. I think maybe for those of us right now that are having to do these things with our hands, I think we'd be very sad that if it got taken out of our hands. But at the end of the day, it will be interesting to see how technology develops for this.
And the technology, if I was an engineer developing this robot that can cut a crown, I would still need a dentist to come and tell me how the crown is cut, and I'll need to see him prep it because I need to train this robot to do the same kind of thing.
You're gonna have to give it a data set.
Give
it some data.
It's always it starts from the old school kind of way, and then you try to transfer it into a machine or something. But I guess the closest robots would be that Da Vinci robot. But I don't know, I feel sometimes we forget how amazing humans are, the level of motor control that we have, and our brains like working at the same time. Like it's very, very difficult to design a robot that can actually do that. Yeah. So
I mean, look at the state of the lab that we have right now. Like, we have a fantastic lab who are extremely talented, and that skill only comes with years and years of work and practice and repetition. And even beyond that, like, I think that our lab is just also really creative and good. But like, we're also a practice that I think prides itself on technology and being able to like, maybe take some of those traditional lab things out of the equation and now be able to mill. But you're right, I think maybe you're right. You were saying earlier, you were hoping that technology at the end of the day doesn't replace us, but makes us better, right? That we're able to use it. And I think that's probably, more or less what we're trying to do with our lab, right? They are really combining technology with their traditional,
but I think
techniques.
they still need like the hand skills. Like I think a lot of new technicians who only have experience with digital, like they struggle with the hand skills because like to them, like the computer is like doing everything. Like you propose the design, but like the designs that come out is not immediately usable. They need to modify it. But like if you don't know how to modify, then like you're just stuck because the computer only gave you like up to that level, and you still need the human finishing to take it to like the next level. So I don't think we're going to be replaced anytime soon.
Yeah, not during our lifetimes.
Yeah, but
it may affect how we work.
No, but actually, like if we're talking about technology, like if they can find like machines to help us to practice like more ergonomically, I think that will help a lot. Yeah, like that's because that's the part of dentistry that sucks. Like, the tight working space, and sometimes you're just in very awkward positions. Like if they can find a way to make that easier, then like that's what technology is for. It's supposed to make your life easier, right? Not more difficult.
So what do you think is actually going to go first? Do you think the surgical aspect of our profession, or do you think the diagnostic aspect of our profession is going to go first?
Diagnostic. Because like it's already happening.
Then aren't we just going to become techs then? I mean, dentistry will be reduced to techs. Like, I mean, we have lovely techs and they're very, very talented. When I say reduced to techs, what I mean is...
Well, like just cutting a crown blindly because the AI
right.
told you.
I mean, if AI is diagnosing it, and like, eventually we already have computers that have cut their first crown, right? Or robots that have cut their first crown.
But like, what if the patient doesn't agree with the suggestion then?
Well, I think then also, it opens a bigger can of worms that whether dentistry is going to be commoditized in the future or not. If you have all this,
is.
Even more so, right?
Yeah.
Like basically, like maybe patients aren't going to understand the nuance that a certain provider provides, that they could, like maybe they're just going to settle. Maybe they will be contented with settling for whatever Google throws at them, whatever ChatGPT like gives them as a diagnosis and treatment available. Like, I think we just have to figure that I think there's such like a potential paradigm shift in how people think. I don't know how trusting or distrusting people are going to be of this technology in years to come, but some people may not require the nuance anymore. Okay, you're a much bigger of a foodie person than I am, and I don't know if the listeners here are Singaporeans, because I think every Singaporean is a bigger foodie than I am. But like for me, a lot of times, I'm sorry, like food is like a commodity to me. Like a pasta is a pasta is a pasta a pasta. Like like a chicken rice is a chicken rice is a chicken rice is a chicken rice. So I mean,
I think maybe I'm not going to contradict you. You are correct in that for the mass market. So you can think of it as like super cheap mass market and prestige. So I think mass market, it's probably fine. So for those patients who don't have very complex problems, like they just need like maybe one filling and they just need things maintained, or like they need someone to monitor their condition, then I think AI is quite good at doing that. And maybe in the future, they don't even need to come into the office to get that done, which is already kind of happening with things like dental monitoring. But like if you are maybe prestige, okay, you like don't want that, or you don't mind that, but you need someone to come in and like kind of override or tweak things like a little bit. So I think that's where it's gonna kind of make like a big difference. So it's the same like food, like pasta. Yeah, I mean like supermarket pasta, it's all kind of the same. But like if you've had really bad pasta, I'm sure you will remember because it's so bad. And then if you had really, really like exceptional pasta, then you'll remember. So like I think it's the same for like
I swear, if patients are listening to this, I'm gonna be like losing all my Singaporean friends and all of my Singaporean patients.
No,
that I don't have
they will
in.
just tell you where to go and eat. Like the Singaporeans will always recommend, oh, you don't like this? Okay, you haven't tried this. You don't like it because you haven't tried this best thing. So like,
So that's why I think.
Yeah.
So I think like it's a strata of care. Like
Yes.
at least in the short long term, I don't know, like medium term, like it's a strata of care is what it seems like. We kind of like, I feel like we're kind of converging on that general consensus that like as AI and technology, Google even becomes more and more sophisticated, it will just lead to essentially a strata of care.
But then the question is like the platform's agenda, like who owns the platform?
Yeah,
so it's like,
you're a very suspicious person.
no, I mean in the end, like, okay, why is Google free? How is Google free? Like they're selling ads to you, right? And like now Google is so huge, it needs like so much like resources, like servers, like electricity. And I mean AI like sucks like so much like electricity just to ask like one question. So how do you square away that like it's not just a benign tool? Like,
do you think Wikipedia is a benign tool?
I mean, Wikipedia, like, because anyone can edit. So again, it's like
maybe DeepSeek will be the Wikipedia of AI.
Okay, so I mean, okay, Wikipedia, like if I don't like someone, I can just go and write like something fake like on the Wikipedia entry about them. But I guess like they have moderation, but I mean, you hope that the moderation process is actually working, right? But again, it comes down to, okay, like to quote your favorite book, Dune, like, I mean, the events of Dune were like partly triggered by this thing where they called the Butlerian Jihad, where they actually, like, humans revolted against AI. So it's like, are we at the beginning of that, like, AI kind of take over? I mean, yeah, like, you know, it's such a prescient book. So, like, I think it's right to be suspicious because, like, in the end, and also, like, you know, is AI going to uplift, like, you know, human living standards in total? Like, or are we still going to keep, like, oppressing people because, like, oh, we want, like, cheap labor? When AI or technology in general is supposed to make life easier. But it doesn't seem to be, like, going in that way. So, I mean, these are, like, very big questions which, like, it's probably beyond the scope of this, like, podcast. But, I mean, I do think about it, like, yeah, new technology is good, but again, you have to examine like who owns it, like who's making money off of it, and like is it really going to be good for humanity as a whole, I guess.
True. I hope I just hope it doesn't affect us too much during our lifetime, huh?
I don't think it will. Like
we still have years to go before we retire. We need to
I don't think so. It will. I don't think it can replace us. But it will be good if we can like use it to help us. Yeah, that's like the main thing. Like, to help us and help us help our patients like better. Yeah,
I can agree to that.
But yeah, I think it's a good thing to end this first like episode that we have done together. Yeah, like hope you guys enjoyed. And yeah, if you would like to see more episodes with us or our other colleagues who are going to be filming some upcoming episodes, like please drop us a comment and a like. And yeah, I hope to see you guys soon. Oh, and remember to give a thumbs up for like Dustin, to tell him that you can understand what he's saying. If not, then half of this conversation is totally unusable. That's okay. Even if you understood me, it's probably useless anyways. No. All right. Well, thank you guys. Appreciate it. See you. Bye-bye. Bye.